professionals. So talk to us about some of those.
Well, those the habits.
Okay.
For example, if you don't have a gap tooth, why do you want to create a gap tooth?
So I can have a gap tooth.
So if you want to create a gap tooth, artificial gap tooth, then something must go for it. If you if you want a gap tooth, there are ways you can actually have it. Okay. But gap tooth medically is an abnormal dentition. Yes, when you have a gap tooth, that's what we call malocclusion. It's a bad occlusion. We are not supposed to have gap tooth. People that have a gap tooth, they don't have bad. Their teeth are not good. Yes. So usually when people that wear braces, they use braces to actually close tooth that have gap, excessive gap. You can use braces to close them up.
Okay.
So creating a gap tooth, maybe with the use of shiso or file, you are gradually removing the protective layer of the tooth, which we call the enamel. The one you are seeing on the outside of the surface, that glistering luster on the surface of the tooth is the enamel, and that is the hardest bone in the hardest bone in the body. It protects the tooth. But how you use physical or chemical method to remove the protective layer of the tooth, you are exposing the inner part of the tooth to bacterial ingress. So as a result of that, decay can actually start from there. Then person begin to have pain. Before you know it, we have swelling. But that one may not necessarily lead to oral cancer. It can lead to other form of infection in the mouth that may actually bring the patient to the hospital.
Okay, so how about the piercing of the tongue?
Piercing of the tongue is also not good. Apart from the fact that it's going to affect the function. The tongue has a function to speak and to swallow. So by the time you pierce it, apart from the fact that you may not be able to, your swallowing will be very clumsy because there is a foreign body there. Maybe you pierce it and put a ring.
Yeah.
It's a foreign body. Your swallowing will not be smooth. Then, even when you are talking, because there is a foreign body on the tongue, the free movement of the tongue will not be there. It's just like when you put a coin in your tongue and try to talk, or you put in a piece of sweet or any confectionery on top of your tongue and begin to talk. You find out that your tongue is not as smooth as when the tongue is empty.
Wow.
So piercing the tongue usually we discourage it.
So how about teeth whitening? I've heard a lot of things about it.
Yes, it's just like people bleaching, skin whitening. You want to bleach your skin. You can also bleach the teeth.
But then the teeth, is it not... Okay, how do we get the teeth that has changed color now to come back to its original state?
Yes, there are many.
To be white.
There are many methods. By the time you visit the dentist, they will first of all identify what led to the discoloration of this tooth.
Okay.
From the etiology, from what caused the discoloration, they will now find a solution. Is it as a result of decay? Is it as a result of maybe the tooth is dead? There is blood leak inside the tooth that now spread to all the adjacent tissue of the tooth, or is it as a result of a pregnant woman that took drugs that were not supposed to be taken at a particular stage of pregnancy, that they eventually colored the teeth of their baby? So by the time you go to those are the questions we normally ask the patient. We take a detailed history to find out, try to identify the cause of the discoloration. For after knowing the cause of the discoloration, you can find a solution. There are many ways you can make a very black tooth to become very white without even bleaching. Bleaching is just one of them, and it's not in all the tooth discoloration bleaching can solve. Bleaching cannot solve all tooth discoloration.
Okay, so also let me get this. What's the color of the teeth?
It's not pure white.
Oh,
it's milk. Yes.
Really?
Yes, it's not. When you mean white, it's not as white.
But then
as
we see the toothpaste adverts. I mean, you're a dentist.
Yes.
And I'm sure you see those adverts. And when you see those adverts, you'll be like, my teeth is not it though. It's like there's something missing here.
Well, they are just those are commercial adverts to attract people because people they are trying to capitalize on people's what do I say?
Ignorance.
May not be ignorance. The fantasy. I want a white teeth. If you actually compare teeth, the one they even advertising on the television, compared to an A4 white paper, you find out that A4 white paper is actually whiter than what they're advertising. So tooth is not pure. It's not pure white. It's not pure white.
Wow.
Yes.
Okay. Well, we have a commercial break coming up. We're still talking about mouth cancers or oral cancers, as they call it in the medical field. And Dr. Lucky Ofomola is in the studio. If you have any questions concerning your oral health, all right, you can as well send a message via WhatsApp or get on Facebook and drop a comment there. He will answer you. The number to send a message to is 0809 030 6416. 0809 030 6416. We're live on Facebook, so get on Facebook at Nigeria Info 92.3 PH. Like the page and drop a comment. I'll be right back after this break. Stay tuned. So cancer that develops in any part of the mouth, that is oral cancer or mouth cancer. So there are risk factors, as Dr. Lucky has mentioned. We have tobacco use, heavy alcohol use, and human papillomavirus infection. And he said that usually we have people come to the hospital only when it has become really bad. They've tried every other thing and all those things did not work. And so they show up in the hospital when the situation is now dire. And then at that point in time, there's little or nothing the doctor can do. And most times it turns out bad. Mouth cancers. All right. So we're taking questions, all right, that anything that concerns your oral health. If you have any questions you want to ask, you can as well ask those questions. We'll get to the part where Dr. Lucky helps us to understand how we should even know that, first of all, what I am seeing in my mouth or what I'm feeling in my mouth could be cancer, so that I can get to the hospital early enough and get it out, all right? He'll talk to us about that. But let's hear from you first. You can call the numbers 0817 923 0002, 0817 923 0002, and 0817 923 0003, 0817 923 0003. For your WhatsApp messages, send them to 0809 030 6416. Joy from Port Harcourt says, good afternoon, please. Is there food one can eat to make the gum and teeth stronger? And then the next person is asking, I have noticed some black color just at my teeth gum. I'm sure this person is asking for what they can do to get rid of that. All right, Dr. Lucky.
Okay, the question, thank you for asking. In respect of your gum being strong, there is no particular food we will say go and eat. Once you get your normal balanced diet, let there be the appropriate quantity of protein, carbohydrate, mineral salt, and multivitamins. once you get those things in their appropriate proportions, then you are good to go. Your gum will be strong.
Okay.
Vitamins in particular are very good because vitamin C in particular they are very good for the gum. So you take a lot of fruit and vegetables. It will help the gum to get a strong gum.
So recently, I think that was last night, I read something about onions having a very good quantity of vitamin C's, though. So talking about this question about the gum being soft. So first of all, how come a person's gum gets soft? What are the things that could lead to that?
When the word soft is relative, because there is we don't have a yardstick to actually measure the hardness or the softness of the gum.
But this person knows that
it's soft.
My gum this is not normal.
So that is really to oral health. When they examine the gum and they find out that this gum is abnormally hard or it's abnormally soft, then
but generally, what are the things that could lead to an abnormally soft or abnormally hard gum?
Cancer can be one of them. When you have the abnormal growth, you have an abnormal growth, you have a swelling there, maybe there's an abscess, there is pus gathering around the gum. When you touch, when the surface of abscess is usually very soft.
Okay.
If you touch an abscess gum, it will be soft. So if there's a bony growth from the gum, the gum is covering a mass of bone. Where there's a growth of the abnormal growth of the bone inside, you find out that the gum will also enlarge. And because the bone under it is strong, the gum will be very strong as well. Will be very strong as well.
Does the method of brushing or the manner in which a person brushes their teeth have any effects on the gum, whether it's going to be too soft or too hard?
No, it does. For example, the nature of the brush you use, but it may not actually necessarily mean it translate to the hardness or the softness of the gum.
Okay.
But the way you brush can actually make the gum to wear off the tooth. Before you know it, usually the gum covers the tooth to the neck of the tooth. With bad brushing habit, you begin to wear the gum down. Then the root of the tooth begin to show, just like a tree standing by where the erosion is passing. With time, the root of the we start seeing the root. So if you brush in an abnormal form,
what do you call abnormal?
Yes, there is usually a brushing pattern.
All right.
It's not just like this, and not all form of toothbrush that we recommend. If the brush is too hard, you damage the gum. It's like tantamount to using an iron brush to wash your pot. You wash the pot gradually with iron brush. With time, you get plus you're going to get a hole.
Yeah. So
if you use a very hard brush, for God's sake, you are not washing car tires. It's your tooth. If you use a very hard brush to brush the teeth, you wear off the gum. Particularly if you are using a very bad technique. There are techniques of brushing. It's usually we open your mouth, you brush it up for the upper teeth. You brush it downward. You orient the brush around 45 degrees to the teeth. You stroke it downward. For the lower one, you orient the brush the same thing. You brush it upward.
Like that's what I'll be doing
when sideways.
When I'm trying to rush so I can meet and pass traffic.
So that's why people do, because they want to rush and pass traffic. They just do left and right, left and right, left and right, left and right, without brushing the up and down pattern, and without even brushing the surface of their tongue. They just brush. They will tell you they have brushed and they go.
So how about those people that when they are brushing, it's as if there is a war? Russia-Ukraine war is happening.
Because that is the same thing we are talking about.
They feel I brush once a day. That one is one.
It's a bad method. It's not by brushing once a day or by brushing very hard. Then you must have removed the thing. Because the tooth, even after brushing your tooth, in less than 1 hour, if you use your nail to scrape the surface of the tooth, you still find some jelly-like stuff actually sticking to your nails. It means bacteria have started forming on the surface of the tooth. Then what we call pellicle. From there, it can turn to plaque. That is people normally see on the surface of the tooth. From the plaque, it can become hardened, just like the question that person asked. He said that there's a black substance. It's a black color. color. It could just be a plug that has
Good afternoon.
Turn off your radio set, please. Good afternoon.
Okay. Jonathan talking.
Jonathan talking. Turn off your radio set. Jonathan talking.
Half office.
All right. Thank you. Go on.
Please, can expired things and other food can't it cause this cancer you people are saying?
Can what?
Something expired when you take it without knowing that it's expired.
Do you mean
Like
eating something that is expired?
Like food or something, beverages.
Okay. All right.
Yeah.
Thank you very much. So, did you get the question?
I got the question. Whether expired items, food, beverages, and whether can they cause cancer? Like we said before, you cannot actually pinpoint this is the cause of this cancer. So if an item is expired, it means the original constituent of those items they are no longer they are no longer there. It has transformed to other form of chemicals that could also be dangerous to your health. So if there is an expired item, it's expired, you discard it.
Okay. All right, so I've got another question for you. And this is coming from who? Ere. Ere says, good afternoon, presenter and doctor in the studio. Please don't be offended with my question. Can oral sex cause mouth cancer or odor? Thank you.
Yes, it can. When we're talking about risk factor or predisposing factor, we made mention of viruses, human papilloma virus.
Yeah.
So, and the genitals are areas where you can get those type of viruses. So, by the time you engage in oral sex, you are actually transmitting viruses from the genital to the mouth.
Ouch. All right, so Ere, there you have your answer. Who's this? Please, I want to know the relationship between you and the herbal dentists, because they are the ones that give people with dental issues some hopes with their products. Mark P.
Oh, thank you, Mark P. Unfortunately, we don't have any relationship. We actually try to encourage the public not to patronize them.
Why?
Because most of the product they are selling to you, I don't want to mention name. There are some oral health products they sell that does not meet NAFDAC standards. For every toothpaste that we recommend, we have to be sure it is safe. Secondly, there must be fluoride in it.
Okay.
Any toothpaste that does not have fluoride, if you are just using soap to wash your teeth, it does not protect. It is fluoride that actually it gives that protection to the tooth surface. So if there's no fluoride, what you are using is not toothpaste.
So here,
so most of the ones they say, the traditional people, what do you call it, the herbal doctors say they don't have. There's no fluoride in them.
So since we're talking about toothpaste right now, sometimes you see toothpaste. I mean, when you go to a shop to get a toothpaste, a supermarket, right? You find out that a particular product could have like 4 different kinds.
Yes.
And they will tell you this one is for those who have sensitive teeth.
Yes.
This one is for if you want to have whiter teeth. And this one is for fresher breath.
That is true. Because
Okay.
each of these toothpastes have been formulated to meet the need of the user. For example, somebody that have bad breath and want fresher breath, definitely will go for the one with more of minty flavor.
Okay.
Those that have teeth that are a bit dull, they want the teeth whiter. So they have added something that we try to that will minimally bleach the surface of the tooth to make it a bit whiter than the original the way it was before.
Okay.
There are those that have gum bleeding. There are chemicals that have been added to the toothpaste that can actually prevent bleeding. Those that have sensitivity, there are chemicals that have been added to that paste to reduce the sensitivity they are having.
All right.
Yeah.
This one here, this one is This person is asking you to rate her teeth. So she took a photograph of her teeth and she says, "Sir, rate my teeth." Oh my God. Hi, Bila here. Please help me ask the doctor. I noticed a painless white growth like a ripe pimple just at the base of my lower lip. What could that be? I keep a good oral hygiene.
Well, that is the more reason you need to see a dentist or an oral health professional, because we cannot from this distance know what it is. One, we need to examine you. There are a lot of questions we will ask you, what we call history. How long has it been there? Have you been having pain on it? Is there wound? Is there an ulcer around it? Have you lost weight? Is it bleeding? So these are questions we will not be able to ask you through this program. So you need to visit the hospital. Then where those questions will be asked. Then a few tests will be done to actually identify what that swelling is.
All right. So someone is asking, Jude Uboma on Facebook is asking, how can one restore a receding gum?
Receding gum is actually a very big challenge.
Oh.
Yes. Once the gum starts receding, even though when you have stopped the course, maybe the way you are initially brushing was not the right brushing technique, and you have stopped, it is difficult for the gum to grow back.
Oh wow!
But there are surgeries that can be done.
Surgeries.
Yes, there are surgeries that can be done that can now peel the gum from the below, from the under, and raise it up to cover the area that have been exposed. All those roots that have been exposed, surgery can be done to cover them back.
All right. Hello.
Hello, good afternoon.
Good afternoon. What's your name?
Hello, good afternoon.
You're welcome. What's your name?
My name is Daniel, calling from Pitoko.
All right, Daniel, we're listening.
Please, I have a question for your guest in the studio.
Go on.
I have this oral problem since 2013. And when I've gone to several hospitals, they told me that it's Aptos ulcer, or there's another name for it, canker sore. So since then it has been appearing and disappearing. I've taken some supplements like vitamin C, folic acid, and a series of tests have been conducted like HIV. All these tests have been negative. So I don't know what would be the cause. The major issue there is that whenever it comes, I will just be ashamed. I will so lean that people will start asking, were you sick? And the moment that thing disappears, even without taking drugs, it will now I will now get back my body. And it's now coming like every 3 days. Before it used to be like every month, from every month to every 2 weeks, from every 2 weeks to 1 month, and now it's just engaged. So I don't know where to go. I don't know the right treatment to take anymore.
Thank you for calling. You want to answer that now?
Yes, thank you, sir. The first thing I want to advise, I will advise you to come to the teaching hospital, where there are specialists who are specializing in that kind of problem. So what you are having is what they call Aptos ulcer, recurrent Aptos ulcer. Usually there are predisposing factors. There are things that can actually make it occur regularly like that.
Things like what? Things
like maybe stress. Yes. Stress you can see that its own is now recurrent. Maybe once in a month. Anytime there is episode of stress, the ulcer can just come. Anytime there is episode of maybe lower immunity, person is not too fine, maybe it's not eating well, malnutrition, the ulcer can just come. So person is preparing for an exam, or person is recently bereaved. So anything that can cause stress at all can make that ulcer to recur. Then there are some other systemic diseases that can just show face as ulcer in the mouth that is not healing. So by the time you come to the hospital, there are a lot of investigation, a lot of tests. There are some tests we have to do to actually exclude other causes of this ulcer. Is it just a mere aphthous ulcer, or is it a syndrome? Is it an ulcer that is associated with syndromes? So these are what the hospital specialists will be able to discuss with you when you come to the hospital.
Okay. Hello, good afternoon to you, Lady Constance and our doctor. Please, I once had a minor home accident where I hit my forehead on the wall because the room was dark and it affected my 2 front teeth, making it have cracks. Although that was since 2016. Though the cracks are sometimes invisible unless you look closely and it's not painful. Please, is there anything I can do to heal the cracks or will it have any implication? From Caroline.
Well, that crack will not heal on its own because the tooth, the way it is structured, crack hardly heals. It's a very strong tooth, is a very strong bone. It hardly heals. What I would advise you, because if so, since that you know there is a crack, with time, that crack is going to gradually expand. And when it expands and get to the pulp, to the where the nerves and the blood vessels of the teeth are, you start having pain. So now that it has not get to that stage, I think you should visit an oral health professional, a dentist. Let them do a thorough examination. Maybe you take a few X-rays to actually show that the level or the extent of that crack. Then the tooth can actually, they can crown that tooth. Okay. Just make a crown for it and to give it a permanent protection. Because if the crack is already there, with time, as you are putting the tooth to use, with time, the crack is going to expand and the tooth will give way. All
right. So while you're sending in your messages, let's now talk about how to know that someone has oral cancer. What are the features?
The commonest one is pain. Most of them have pain in the mouth or structures around the mouth, the lip, the jaws can have pain.
Okay.
Some of them have white or red patches on the mucosa, that on the cheek, inside of the mouth.
Okay.
Or the surface of the tongue, or the palate. You can have abnormal patches. This color, why is my mouth? Which color is this? You can have abnormal patches. The patches could be white, it could be red. Those are form of pre-malignant lesion. They are trying to. These are sign of cancer. Then some people can have swelling. You can have swelling.
Okay.
Then you can have sores, ulcers, wound that that is not healing. You have a wound on your tongue or your lip, 1 week, 2 weeks, 3 weeks, it's not healing, this wound is there. Sometimes it might even be increasing in size. Then it's sinister. Something has to be done. Then there are times because it's the most visible part of the mouth is the tongue, is the teeth. The teeth will become loose. Instead of being very firm, they become loose. They become what we call mobile. They are no longer firm because the cancer has eaten up the foundation. The supporting structure has been eaten up. So the tooth become loose. When you find out that your teeth are just becoming loose without any reason, they are just shaking on their own and with a swelling around it, then something drastic has to be done. Then another some people can have bleeding. People will just be bleeding without any injury. Can have bleeding. Some people have change in their voice because when the cancer have spread to the throat, you can voice your vocal cord, and once the vocal cord is already involved, your voice will change. Your tone, your voice will change. People will be asking, did you go to? Did you sing throughout the night? They don't know that it is cancer that is spreading. Then you can have numbness. The area where the cancer is, usually the face is it's a very strong. It's a lot of nerves that supply the face.
Okay. If
the cancer is in an area where there is a nerve, and the nerve is already involved in the cancer, in the tumor, then that nerve will not do its normal work on supplying sensation to that area. So the pain may become very numb. It becomes numb. Some they have stuffy nose, because when the cancer has grown, if it's growing upward,
Okay.
it can affect the nostrils and block the nose. Just weight loss of unknown, they cannot explain why they are losing weight. They can't explain. Some have some bumps around their neck, what we call lymph nodes, around their neck. Then some people even cough once the cancer has started spreading to other part of the body, and rather from the mouth to maybe to the chest or to other part, the person can start coughing. He cough maybe with blood or without blood. So when you see all these signs, then they are not good signs at all.
Okay. We have a couple of questions here as well. What can a person do to the hole in the tooth? My sister has it and has been going to feel it over and over, but a little while the feelings wear off. What is a permanent solution?
Well, and when it may also be a poor technique of filling. If the filling is not properly done, it will not last. So that's why you should visit a very good place where the filling can be placed. It also depend on the type of hole. Is the hole, what is the nature of the hole? Because there are some holes that are very difficult to fill. So if it's that kind of, if you fall into that category, the tooth can be crowned instead of filling and filling and filling and. Why don't you just wear the tooth a cap, a permanent cap? You wear the tooth a crown, so that crown will serve as your permanent solution instead of regular filling that will fall off.
All right, so this person says, my fiance sometimes has mouth odor, which he has tried to treat, but to no avail. Though it's not all the time that he has the odor, but most times. What could be the cause?
Well, we need to know the causes of the bad breath. Usually, bad breath, it can either be from the mouth, or from the nose, or from the other part of the body. So by the time she visits the hospital, there are a series of questions we want to ask to actually know the source of this bad breath. Is it from the mouth? If it's from the mouth, we examine the mouth. Are there decay? Are there tooth decay? Because there's no way a decaying substance can smell well. If there is decay on the tooth, are there gum diseases? Are there bleeding in that gum? What is the oral hygiene like? Are the teeth clean? So if we now, by the time we're able to exclude oral cause, maybe the cause of the bad breath is not from the mouth, we'll focus on other areas. Is it from the nose? There are questions we'll ask whether it's having sinusitis or having other nose infection. There are questions we'll ask. Or is it from the general body? People that have DM, people that have cough, that have TB, they can have because the mouth is just like an exhaust of a car. From where other part of the body can express whatever they have.
So the odor can be coming from within.
From within, can be from the stomach, can be from the lungs. It can be from people that have kidney problem, liver problem. So that is why when you come, these are questions we will ask. People will be saying, how does that question relate to my bad breath? You ask me whether I have ulcer. You ask me whether I have TB. You ask me whether I have I'm coughing. So they are all related. The body is one. When one part of the body is having issues, every part is also affected. It's affected.
All right. So this person on Twitter is asking. The person says, "I have scattered teeth. Please, I want to know the price ranges of affordable braces to make it arranged. Thanks." Well, Dr. Lucky is not going to tell you price ranges here. You have to go and visit them at the hospital to find out price. But is it affordable?
It's very affordable. Teaching hospital is very, very affordable. That is where you get the cheapest.
So, Money Couture on Twitter. There you have your answer. Dr. Lucky says it's very affordable. He didn't just say it's affordable. Very
affordable.
All right.
Yes.
So this last one before we go. Good afternoon, Constance and Doctor. Can the dental clinic bring brownish tooth to become white? Kel in Port Harcourt.
That is, yes, it can. But we need to know the cause of was the brownish teeth, was it inborn?
Is it follow-come?
In a follow-come or it's acquired? Okay. If it is acquired, By the time we clean, there are things, there are chemicals, there are instruments you can use to clean the teeth and remove for the people that smoke, that have a lot of stain that color their teeth brown. You can remove those stains manually, and the teeth become white. But if it is a follow come,
goes back smoking, uncle.
Then the stain goes back. It means that person needs to be visited dentist regularly. Regularly.
Interesting.
So if it is follow come, then there are other things you need to do. So you can wear veneer. You can just wear some. You're like women that are wearing makeup. You can put a makeup on the tooth, what we call veneers. Just cover the brownish part. What we are seeing is outside is white.
Okay.
Like you have fine teeth.
All right, let's quickly go on a break and then we'll wrap up when we return.
The show continues.
And we're wrapping up. So, Dr. Lucky, very quickly then, for someone who already has mouth issues, it could be cancer, it could be ulcer, or whatever it is, how can treatment be done?
Well, for oral cancers, when it has been diagnosed that the tumor or the swelling is actually a cancer, then we'll go to a staging.
Okay.
Because we need to stage the cancer. Is it stage 1? Is it stage 2? Is it stage 3? Because the treatment for stage 1 is different from treatment for stage 4.
Okay.
The stage 4 is the palliative, is the last stage, very bad. That's the palliative. So the treatment, when you have staged, the treatment now depends on, are we going to go for surgery alone? You can do surgery. You can do radiotherapy. That is, we use a form of X-ray to burn the cancer cell that surgery could not remove.
Laser.
Yes, not laser per se, but it's a form of X-ray.
Okay.
It's radiotherapy. Then you can also use drug. There's chemotherapy. There are other newer methods, gene therapy, immunotherapy. There's a newer method or targeted therapy. There are newer method of trying to cure cancer. So the staging is very important. What's the stage 1? Surgery alone may just suffice. Maybe stage 1 and 2. Surgery and radiotherapy may just suffice.
So someone might be listening to us right now and will be like, all this one that these people are talking. If you people use beta kai to be rinsing your mouth in the morning, you'll not be talking all these things people are talking here. What's your take on that?
The kai, like we said, alcohol is a risk factor.
Just to rinse the mouth?
Yes, you are fertilizing the cancer.
Okay. So how often should we visit a dental clinic?
Usually, we dentists advise you see the dentist twice in a year, every 6 months.
Oh wow! So
even though you don't have any complaint, just go. They will check if there's anything that is just cropping up. They will tell you, see what I see. Oh. It may be cancer. At that early stage, will be identified and nipped in the bud.
All right. So twice every year.
Twice every year.
Thank you very much, Dr. Lucky Ofomola, dental surgeon from UPTH. Thank you for being on Mind, Body and Soul today.
Thank you. Thank you so much.
All right. And thank you for your messages and your calls. Thank you for joining the sunny side today. I'll see you tomorrow. But remember, follow us on social media. Nigeria Info 92.3 PH on Facebook, Nigeria Info FM _PH on Instagram, and Nigeria Info PH on Twitter and YouTube. Or you can also visit our website at www.nigeriainfo.fm. You can find me, Constance Mega, on Twitter and Constance Mega on LinkedIn and Instagram. All right. Rivers Today comes up at 3, after which Hard Facts will take center stage with Dio. My name is Constance Iroele-Mega. I'll see you tomorrow. God bless you.